And we're live. Awesome. I'm here with my friend, Dr. Abby Bleistein today from Healthful Life MD. And Abby's a physician, a board certified in internal medicine, pediatrics, and obesity medicine. She's a Colorado native and a graduate of the University of Colorado Health Sciences Center. She practiced primary care for 14 years, treating patients of all ages to improve their health. Frustrated with the standard model of care that left patients shortchanged on time and empathy, this is why she decided to start Healthful Life MD. So she provides comprehensive, compassionate, and coordinated care along with her team of health professionals focused on nutrition, movement, psychology, and meal planning and preparation. Dr. Abby, I'm so glad to have you here today.
Well, thank you so much for having me today. I'm excited to talk with you.
It's awesome that everyone gets to meet you and learn a little bit about you. So obviously we all know we're just a couple days around the corner from Thanksgiving and we're approaching, a month full of holidays. And this time can be exceptionally difficult, especially as it surrounds food and especially as it surrounds those who are carrying excess weight. So let's talk about strategies for success, both for us as dames and then our family members. And, the goal of this broadcast is to get people aware of you and what the services are that you provide, and also to help everyone understand that you don't have to be in Colorado to engage working with you. Although if someone watching or knows someone who's watching knows someone who is carrying excess weight and wants that support of medical care of weight loss, they should contact you. And you've developed an awesome program called Food, Feelings, and Freeing Yourself.
There you go.
And that program is available to anyone, anywhere.
Absolutely. Yeah.
So want to make sure that everyone knows that they can contact you that way. So we'll talk more about that, but let's jump in and start talking about what are 3 things that people can do as they approach the holidays to have more success around food and negative emotions that tend to come with the territory.
Absolutely. Yeah. So, you're exactly right. When we think about the holidays, there's a lot of great things, but it can be a really difficult time for people sometimes as well. If we've lost a loved one this year, it can make it a very difficult period of time. Or if we've lost a loved one, my mother-in-law actually passed away just right after Thanksgiving last year. So this is our first holiday without her. So loss can really be felt deeply. Isolation is felt more deeply. And people who have mood issues already, it can be exacerbated around the stress or the isolation of the holidays, can sometimes bring up old feelings. And so it's important to remember that. So, when I think about 3 things that can really help people, I want people to remember about setting boundaries, about acceptance, and about making a plan, right? So those are 3 really important things that I like to think about. So let's think about boundary setting. Boundary setting is kind of hard sometimes for people to do, right? But around the holidays in particular, it's really important. So I like people to think about, and we actually presented this in the Food, Feelings, and Freeing Yourself program, where we talked about our circles of connection. And so we have kind of our inner circle, those people who are really closest to us and very important in our lives. There's sort of a middle circle, which might include, close friends and neighbors and such. And then an outer circle, which might be just acquaintances. And when we get to the holidays, there are lots and lots of events and things that come up. And we really want to start to prioritize what's most important to me, because we can get overwhelmed if we try to participate in everything. So setting boundaries and remembering, what's most important to you, learning to say no, right? And then really important, I'm hearing this from a lot of people, is when we think about COVID, we all have different expectations about what's safe around COVID and gatherings. And so really make a plan about what you feel is safe and set good boundaries about what your comfort level is. So if somebody's having a big event and you don't feel safe going to a big event, really set a boundary around that. Thank you so much for inviting me. And I don't feel comfortable this year doing it, but I look forward to next year or something in the future, right? Or I look forward to getting together with you one-on-one. So learning to set those boundaries, I think, are important. Acceptance is the other thing. And acceptance, I think about, again, with COVID, it is what it is this year. it's probably not going to look the same as what people expect, what people hope for, and can lead to a lot of disappointment. So I really would encourage people to really say, you know what, this is where we're at. How can I make this event special for me, special for the people who are important to me, still have that connection, even though it's different, right? You're going to say something, I noticed.
No, no,
No,
no.
okay. I thought you were going to say something. But yeah, so, maybe that means reaching out and connecting to people, either Zoom or phone calls. It's not the same. The connection matters. And it's really important, for your health and well-being to remember to connect to people, even though it looks different, right? And maybe creating new traditions, so this year is going to look different and that's okay. How can you make it special for yourself so it still carries that meaning that you really look for at the holiday time? And then the last thing is really thinking about making a plan. And so when we think about the holidays, we think about people maybe who carry extra weight or not, but it's a very emotional time. It can be very stressful. And some of us may have a tendency to eat, emotionally eat, right? So we get sort of cravings. We tend to eat more. We tend to eat less mindfully. And so really making a plan around that can be helpful for people. So, I recommend to think about things like, am I eating for hunger or am I eating for emotions? And we went through that as well in the food feelings and freeing yourself. We talk about that quite a bit, is what am I actually feeding now? And a lot of times when we're eating, we're not eating for hunger. So if we can recognize, am I hungry or is this an emotion? And then what's the emotion? Is it powerful? Is it a negative emotion, right? And then trying to learn to sit with that. Maybe you do need that comfort. So we talk about riding the wave, right? Can I get through this? What other strategies can I put in so that I can get through this? Maybe I need to take a walk. Maybe I need to call a friend. What's really at play? And is food going to solve that problem? And the other thing is to remember, and I always remind my patients of this, the holiday is one day, right? I mean, the truth is we're celebrating kind of all month, but the holiday, we have Christmas, we have Thanksgiving in terms of food, right? And so maybe make a plan to enjoy the holiday, the foods that have cultural meaning to you, the foods that have emotional meaning, that remind you of family and friends. If you want to have those foods on Thanksgiving, you should enjoy them, not feel guilty, not regret it, but remember it's one day and don't let that kind of continue. Remember your healthy habits, come back to yourself, right? And kind of keep those habits going. And maybe planning around some healthy options, right? So we were talking, your holiday is going to look different this year. Well, I think you did it last year as well, but you've changed your nutritional pattern. And so you've discovered some new recipes and new ways to really celebrate the holiday with those flavors that you love, but within the confines of kind of the healthy nutritional patterns that you've created for yourself. And so I think that's a great way to do it, is to remember those flavors, but to remember kind of a healthy take on them. And so that's always easy to do. So making a plan about how you're going to incorporate what's important to you about the food on the holidays, and then being mindful about how you're eating. Is it emotional, and what's going on there to pay attention?
Beautiful. I love that. So as it pertains to your food feelings and freeing yourself program that you developed, who do you co-facilitate that with?
So I co-facilitate that with Dr. Tanya McFarland, who is a psychologist, and she actually specializes in eating disorders. She's a certified eating disorder specialist. So I like to say, we can kind of help people with eating disorders or disordered eating. So really an expert in helping people with their relationship with food, with issues like stress eating or emotional eating. So she's absolutely fantastic and developed this program with me.
Beautiful. And when you ladies tackle this topic of, emotional eating, let's say, you start feeling, you said very good points there about really setting a plan and understanding, asking yourself those questions so you could figure out emotionally what's happening.
Mm-hmm.
Is there something, I'm throwing this one in there. Is there something that happens neurologically? Like, is it just as possible to have a substitute and say, okay, I've got my veggie tray and my hummus dip that I made from scratch, and that's going to be the thing that I go to when I feel that need to emotionally eat? Psychologically, does it work that way? Is it just as good to have that substitute, and will it satiate that craving?
Yeah, so it's really challenging. So really, when we think about emotional eating, and I always tell my patients this, so eating, and especially eating carbs and those high sugars, high fat foods, right? Those foods release dopamine. The pleasure center of the brain runs on dopamine. And so that's what the food does. So when you say, well, I just feel better when I'm eating them, you do. It really works. It's very effective, but it's not sustainable long term, right? And so the alternatives are certainly healthy to eat, but may not give you that same dopamine release. So there are other ways to release dopamine. And we're actually going to talk a little bit about this in our upcoming talk this week, about how we can use alternative or use other things. So other things that release dopamine and do it well. I love this one is making a list and checking things off. So even if it's something as simple as I'm going to rearrange my silverware drawer, I'm going to rearrange my sock drawer, right? That actually, you put it on a list, you do it, it takes 5 minutes or 10 minutes, and you check it off and it relieves that little burst of dopamine. So I encourage my patients to have a list of kind of little activities, things they want to get done, because that releases that dopamine, right? Connection will release dopamine, releases oxytocin, which is another happy hormone, and releases dopamine. So connecting with people can make a big difference. Playing with a pet, same kind of thing. It releases that dopamine, releases that oxytocin, and exercise. So taking a quick walk, even if it's just a very brief thing, like, I'm going to do a set of lunges across the room. It releases that dopamine and it relieves some of that tension and stress, and gives you that same benefit and boost that you might get from eating.
That sounds awesome. And even just from the perspective of having a recent understanding that we're not going to be able to do Thanksgiving with my family this year, we all are having to make these impromptu changes. So what I just got is, hey, I should set up several Zoom calls throughout the day so that I feel that connection that's happening with my family, even though we don't get to be together. So that's beautiful. Love it.
Yep, that's
so
exactly right.
Let's talk about the Food Feelings and Freeing Yourself program as a whole. So this is a monthly program. People can come in and join at any time.
Yep.
Every month there is a call with you and Dr. Tanya where it's more educational and you're talking about a specific topic. This time it's all about, more in depth about these strategies that we're talking about. But who is the Food Feelings and Freeing Yourself program for in general?
Yeah. So, this is really, as you know, has been a passion project for me, that I really wanted to make higher level counseling type services and support services available to people on their schedule, on their time, to make it really work, because sometimes that's a difficult thing to get involved in, and have access to. And so that's why I developed the program, to really give access to this great level of service to people. And really it's for people who say, if they feel like they allow their emotions or experiences to impact their eating habits or their eating choices, right? Or maybe your relationship with food maybe is holding you back from really reaching your goals and your long-term goals. So you have goals about wellness and health and fitness, and maybe that's holding you back. It could be if you have insecurities that you feel are getting in the way of you leading your best life. What's inhibiting you from really thriving in your life? So we're really looking in detail at these specific areas where we can help you to really thrive. That's my goal, is that you're really going to thrive in your life, and giving you strategies and tools to address these issues that probably have impacted you for a good long time. And our goal is, let's look at it, let's take care of it so that you can move past it and really achieve your goals.
Beautiful. Love it. And they can go to HelpfulLifeMD.com/FFF to learn about this. But so you've got the one facilitated call each month with you and Dr. Tanya, and then you've got sort of a second call that's more along the lines of, okay, we've taught you the material for this month. Where are you struggling with it? Is that right?
Exactly. And so we do kind of a webinar series at the beginning of the month, which you can attend live or you can watch it recorded at any time afterwards as well. And so that includes topics, the one coming up, which is tips and tricks for tough times, which I think is really helpful around the holiday time. But we have other things about maybe living your values. We have a talk coming up on emotional eating, another talk on connection between food and feelings. So we can kind of really take the deep dive into some of these issues. So we have that initial webinar, and then we have some takeaways where you can really practice these strategies and skills that we talk about in the class. And 2 weeks later, we come back together in a support group setting and kind of go through everyone's experience and learn from each other. So it gives people an opportunity to learn the topic, take that deep dive, do the work, and then come back together and get support around it. We talk about, what are your challenges? What did you face? What did you learn? And it's really been just really successful. I love the insight that people bring to that support group in the second part of the month.
That's always, that's the beautiful thing about this is you've set it up as that continuity program where each month there's a new topic and they're getting to learn, like you said, and go deeper with the psychology of eating, but then also from your perspective as a doctor of obesity medicine. I probably said that wrong, but
that's fine.
Having that focus, I think that's what's so different about you approaching weight loss and you approaching the other health issues that are connected to carrying extra weight, is that you actually know what you're talking about. You're not just saying, hey, take this pill or drink this shake and everything is going to go away and you're going to be perfect.
Yeah.
You know the complexity that surrounds the challenges of carrying excess weight. So
absolutely,
and you've decided to specialize in this. So that was a big journey change for you. Before we jump into that last question, I just want to say, please visit HelpfulLifeMD.com/FFF. If
there's a forward slash at the end to get to that too.
Okay.
FFF/. Yeah.
Gotcha.
Sorry.
And I'll make sure to put that in the chat or in the comments too. But if you aren't the person who feels like you need this, but maybe you know somebody who is, it's always a good thing to refer them to. And if they want to talk to Dr. Abby beforehand, she does 20-minute consults that are on her website. You can just schedule that right there at HelpfulLifeMD.com on the contact page. And jumping into the last question. So as we said in your bio, what you experienced in the world of medicine is that people have, basically 15 minutes to visit with you on some of the most complex issues of their life. And that was what really motivated you to start Healthful Life MD, was you saw so many people who are really struggling with that and not being able to feel like they were getting their problems resolved. So what is it about this issue? What is it about obesity that really drives you and that impacts you, or that makes you want to really impact the world as it relates to obesity and carrying extra weight?
Yeah. What I started to see in primary care is that nutrition and fitness, emotional wellness, sleep, all of these things were contributing to patients, not just their sense of well-being, but their actual health. And I was seeing increases in type 2 diabetes, cholesterol problems, in particular, fatty liver disease was increasing. So non-alcoholic fatty liver disease, which is a disease of nutrition, increasing amongst my patients. And it just was starting to feel like this was really the crux of medicine. And I found in the traditional primary care setting, patients need my time. I need to hear what they're doing, what's going on, and how I might support them and help them to make some sustainable lifestyle change. And I didn't have that opportunity in primary care. And it was just really frustrating. It was like a values mismatch for me, that I had all of this to offer patients and I didn't have the ability to do that in that setting. So I really created Healthful Life MD to be a 360-degree look at all aspects of health and wellness. How can I help people live their best life and make sustainable lifestyle change so that it goes on, for good? And so, so everything I've done with the program is really focused on that end, is sustainable lifestyle change. How do I help people get healthy and stay that way so that they can live their best life, enjoy the stuff they like to enjoy? So all those things kind of contributed. And to that that end, I have certainly expertise and a little bit of knowledge in a lot of different things. And certainly the medical piece I know very well, but I don't necessarily know the intricacies of the nutrition or the details around fitness or some of the health psychology issues that come up, whether it's sleep or the disordered eating or, living with chronic medical conditions. So bringing in experts, in all of these areas to support patients on their journey, I think has made all the difference for people in having success, that they have somebody who's sort of a cheerleader for them and working for them to separate kind of the wheat from the chaff, right? What is the real information? Let's get out of fads and let's really help people get healthy. And the chef is the same thing. So many of my patients struggle with, how do I cook healthy meals? People aren't eating real food anymore. So bringing in that chef to really help people learn to cook and eat real food again. So that's really kind of where it came from, is this idea that it's just the crux of medicine, and I can turn around a lot of problems if I can help people in all of these different areas in a comprehensive way. And I can get people off medications. I can help them feel better, decrease pain, improve energy, and really help people thrive in their lives.
Beautiful. I love that. And I know that your clients, your patients, I always say that, your patients get to experience so many different benefits. And I think that's the key that you just said there at the end, is it's not just excess weight. It's all kinds of other health challenges that are wrapped up in that. And if you address it without addressing the medical issues, you can really, do yourself a big disservice or cause potential worse problems. So
yes. Yeah.
Please, if you know someone who is in Colorado and who could use that one-on-one support with not only Dr. Abby, but her team of experts, send them to Healthful Life MD. And how can other members of the DAMES support you in general?
So in general, exactly what you said is, if you yourself, or if you know people who could use this kind of support, I would love to help you. I'm just here for you. I'd love to share with you our experience and help support you on your own health journey. If there are people that you know in your life who would benefit from these services and you could connect me, that would be fabulous. Or if you know people who work with clients who may need or would like these support services. So a lot of times physicians and physician specialists, need this kind of specialized care for their patients. And so if you can connect me to those people, that makes a big difference, so that I can really extend my reach to reach out to more people. And then as well, I'm so thrilled about our Food, Feelings, and Freeing Yourself program. So if you feel like this would benefit you, definitely come check it out. Look at the website. We have a list of all the different topics that are coming up, but it really broadens my ability to support people who need this kind of, intensive work to really make their lives better. So I'd love if you can share that, pass that along to your community or to the people you think would benefit from it. That would be fabulous for me.
Awesome. And we'll make sure that your Facebook page and other social media handles are also included in the comments, so that, if nothing else, a little like and a little share of some of the support and going on and liking some of the posts and content would be great too. Anything can help. So thank you, Dr. Abby, for spending time with me today. And thanks, Dames, for learning about Dr. Abby. And please do share and have a beautiful Thanksgiving, a beautiful, healthy Thanksgiving.
Absolutely.
And just like Healthful Life MD would say, get healthy from the inside out.
Absolutely. Yep. Happy Thanksgiving. Take care.
Bye.
Bye.